The human body is a marvel of engineering, and at the core of it all is the cardiovascular system. It's the highway for life, delivering oxygen and nutrients to every cell in the body. A system that's primarily made up of the heart, blood vessels and blood. It's like a well-oiled machine working non-stop to keep us alive and kicking. The heart, a muscle no larger than your fist, holds the pivotal role of pumping blood throughout the body with a rhythm that's music to our ears. The blood vessels, a complex network of highways and byways, carry this precious cargo, our blood, delivering oxygen, nutrients and hormones to every nook and cranny of our being. A healthy cardiovascular system is undeniably crucial to our overall well-being. It influences everything from our energy levels to our ability to fight off infections. Understanding the cardiovascular system is the first step to decoding the mysteries of various heart diseases. Scene script: imagine a water hose. If the pressure is too high, it can burst. Too low, and it won't reach its destination. The same goes for our blood pressure. Let's start with hypertension, commonly known as high blood pressure. It's as if the water in our metaphorical hose is being sprayed with too much force. This, over time, can damage the walls of our blood vessels and strain our heart. Various factors can contribute to this condition, including a high-sodium diet, lack of physical activity, stress, and even genetics. Symptoms, however, are often elusive. Many people live with hypertension without even realizing it, earning it the nickname the silent killer. Regular checkups are thus crucial for early detection and management. On the other side of the spectrum, we have low blood pressure, or hypertension. This is when the water, or our blood, isn't getting pumped with enough force. It might sound less harmful, but inadequate blood flow can deprive our vital organs of the oxygen and nutrients they need. Causes range from dehydration and certain medications to more serious conditions like heart problems or endocrine disorders. Symptoms can include dizziness, fainting, and fatigue. Like hypertension, regular monitoring can help detect and manage this condition. Now let's talk about treatments. For hypertension, lifestyle changes often form the cornerstone of management. This includes reducing salt intake, regular exercise, and maintaining a healthy weight. Medications may also be prescribed to help control blood pressure levels. As for hypertension, treatment generally focuses on addressing the underlying cause. If it's dehydration, for instance, drinking more water and less alcohol can help. But remember, everyone's body responds differently to treatments. What works for one person might not work for another. That's why it's important to work with healthcare professionals to find the best approach for you. Managing blood pressure isn't just about avoiding problems, it's about promoting long-term health. So make sure to keep an eye on your blood pressure, make healthy lifestyle choices, and seek regular medical advice. The power to maintain a healthy cardiovascular system is quite literally in your hands. Coronary artery disease, often silent and unnoticed, can be likened to a sneak attack on the heart. This condition is a bit like a stealthy enemy, quietly building up defenses and blocking the pathways of your coronary arteries. These arteries are vital because they supply oxygen-rich blood to your heart, and when they're blocked, your heart misses out. Now, what causes these blockages? It's a gradual process called atherosclerosis. It starts when the inner lining of the artery gets damaged, and over time, fat, cholesterol, calcium, and other substances found in the blood start to accumulate at the site of damage. This forms a plaque, which narrows the artery and limits the flow of oxygen-rich blood to the heart. The symptoms of coronary artery disease are often subtle until a significant blockage occurs. They can include chest pain or discomfort, shortness of breath, fatigue, and even heart palpitations. The severity of these symptoms can vary greatly from person to person. Treatment for this condition can range from lifestyle changes and medications to more invasive procedures like angioplasty or bypass surgery. The goal is to restore blood flow to the heart and prevent further damage. It's crucial to remember that early detection plays a significant role in managing this disease. So, if you notice any of these symptoms, don't ignore them. Reach out to your healthcare provider and get checked out. Remember, early detection could be the difference between life and death. Just like a well-tuned orchestra, the heart needs to keep a steady beat. But what happens when the rhythm is off? Imagine a drummer. His beats are the heart's rhythm. When the drummer loses his rhythm, it's like the heart experiencing an arrhythmia. Arrhythmias are irregular, too fast, or too slow heartbeats. They occur when the electrical signals that coordinate your heartbeats don't work properly. This can feel like a fluttering in the chest or a racing heartbeat. Sometimes they're harmless. Other times they can be life-threatening. Arrhythmias can be caused by many factors, including heart disease, stress, and certain medications. They can also be a sign of underlying issues such as high blood pressure or damage from a heart attack. Symptoms can vary wildly from fainting and dizziness to breathlessness or even a feeling of a skipped heartbeat. The good news? Arrhythmias can be managed and treated. Treatments range from simple lifestyle changes like reducing caffeine or alcohol to medication or even a pacemaker in more serious cases. But what if the drummer doesn't just lose his rhythm, but the strength of his beat fades away? This is akin to heart failure, a serious condition where the heart doesn't pump blood as well as it should. Heart failure can be brought on by many conditions that damage the heart, such as coronary artery disease or high blood pressure. Symptoms can include shortness of breath, fatigue, and swelling in your legs, ankles, and feet. Treatment for heart failure often involves managing symptoms and slowing disease progression. This can involve medication, lifestyle changes, and sometimes surgery or devices to help the heart pump better. The key to dealing with arrhythmias and heart failure, like most health issues, is early detection and treatment. Regular heart screenings can help detect these conditions early, allowing for more effective intervention. In essence, just like an orchestra needs a well-tuned instrument to create beautiful music, our bodies need a well-functioning heart to live a healthy life. So let's take care of our hearts and remember, keep your heart in rhythm, stay in tune with your health. While the heart is the star of the cardiovascular system, let's not forget the supporting cast. The blood vessels. When things go awry with these vessels, we encounter what we call peripheral vascular diseases. First up, we have Buerger's disease, also known as thromboangiitis obliterans. This is a rare disorder characterized by inflammation and clotting in the small and medium-sized blood vessels of the hands and feet. It is often linked with heavy tobacco use. Symptoms can include pain, cold sensitivity, and even skin changes or ulcers in severe cases. Treatment revolves around quitting tobacco and managing symptoms, with surgery as a last resort. Next on our list is Raynaud's disease. This is a condition where smaller arteries that supply blood to the skin constrict excessively in response to cold or stress, causing the affected areas, usually the fingers and toes, to turn white, then blue, and finally red. While there is no cure, the symptoms can be managed with lifestyle changes and medication. Moving on, we have deep vein thrombosis, or DVT. This is a blood clot in a deep vein, usually in the leg. DVT can be very serious because it can cause a life-threatening condition called pulmonary embolism if the clot breaks loose and travels to your lungs. Symptoms can include swelling, pain, and redness in the affected leg. Treatment usually involves anticoagulant medications to prevent the clot from growing and to reduce the chance of developing pulmonary embolism. Lastly, we have varicose veins. These are enlarged, swollen and twisting veins, often appearing blue or dark purple. They happen when faulty valves in the veins allow blood to flow in the wrong direction or to pool. Symptoms include aching legs, swollen ankles and skin discoloration. Treatment options range from lifestyle changes to surgical procedures. Each of these diseases, while different in their manifestations, underscore the importance of maintaining the health of our blood vessels. They may not be the star of the show like the heart, but they play a critical role in our overall cardiovascular health. Remember, your body is a complex network of systems working together. When one part suffers, it can have a ripple effect on the others. So let's not forget to take care of our supporting cast, the blood vessels. After all, you wouldn't want to watch a play with only one actor, right? Keeping every part of your cardiovascular system healthy is crucial for a full, vibrant life. From the highs and lows of blood pressure to the silent invasion of coronary artery disease, we've journeyed through the complex world of cardiovascular diseases. We've navigated the turbulent seas of hypertension and low blood pressure, two opposing forces that can wreak havoc on your body if left unchecked. We've delved into the shadowy depths of coronary artery disease, a silent predator that can strike without warning. Next, we've examined the erratic rhythms of arrhythmias and the crushing weight of heart failure, both formidable foes in their own right. Lastly, we've explored the outer reaches of peripheral vascular diseases, from the insidious Buerger's disease and Raynaud's disease to the lurking dangers of deep vein thrombosis and varicose veins. Each of these conditions can pose serious threats to our cardiovascular health, reminding us of the importance of regular checkups and leading a heart-healthy lifestyle. Subscribe for more, because you won't find me later. Together we can keep our hearts beating strong and steady.